Thank you, Dr. Cohen, for your words today, and that is a really momentous step forward. There are so many major steps forward that things are really accelerating on this curve. I think we had the release of the state of indoor air in Australia report a couple of weeks ago in Melbourne from Lydia's group Thrive. There'll be a report announced and released today. Just waiting for a cue to see if we can go with Assistant Minister.
Yes,
2 minutes. Okay, I'll fill some 2 minutes time because otherwise we'll be late. So bear with me. And we're ready here. Okay, so we're really grateful to have Assistant Minister Rebecca White with us today. Rebecca White is the Assistant Minister for Health and Aged Care, Indigenous Health and Women, and Indigenous Health and Women, and a former leader of the Tasmanian Labor Party. Rebecca is passionate about ensuring there is equality of opportunity for all Australians, regardless of where they live, their background or their circumstances. And we'll invite her to say a few words today and to launch the report. Great timing.
Thank you so much. Good morning, everybody, and thank you for your patience while the Parliament's been dealing with some legislation which has kept me away because of votes we've been taking, but I'm really pleased to be able to join with you now. First, I'd like to pay my deep respects to the Ngunnawal and Ngambri people on whose land we are gathering this morning, and acknowledge any elders, past and present, and any Aboriginal people who are joining with us for this occasion too. Thank you very much for the opportunity. And I know you've had some speakers already this morning, and I'm sorry that I've missed those. But before I continue, I'd just like to acknowledge Chief Medical Officer Professor Michael Kidd, who I understand is yet to speak with you. He's doing a pre-record. Fabulous. You've heard already from Senator Michelle Anada Raja, and you will hear later from Dr. Monique Ryan as co-chairs of the Parliamentary Friends of Clean Air Quality Group. Dr. Amanda Cohn from New South Wales Parliament, and congratulations on the inquiry that you've just announced. I think that'll be really interesting to understand what information you received through submissions and what recommendations the New South Wales Parliament is able to provide. Distinguished Professor Lydia Marowska, congratulations. It's such an honour to be in your presence. You're a global leader in indoor air quality who released an important report last month, the State of Indoor Air in Australia in 2025, and of course a recipient of this year's Prime Minister's Prize for Science. Well done. Anna Maria Arabia, where are you? Are you here with us? Up the back. Chief Executive from the Australian Academy of Science, will be launching a new indoor air quality report here, and Liam O'Brien, Assistant Secretary, Australian Council of Trade Unions. Researchers, industry representatives, patients and lived experience advocates, thank you all for joining us here in your Parliament House. Thanks especially to the Safer Air Project, including Plum Stone, Amy Lewis and all their supporters for organising this event and advocating for such an important health equity issue. The quality of our indoor air is not something that most Australians spend much time thinking about, and I don't think many of us thought about it at all until we were dealing with the pandemic. But we know it can greatly affect our health. I am excited to meet and to work with health professionals, air quality experts and others who are taking this health issue seriously. Together, we have an opportunity to build on the Safer Air Project's report, Safer Shared Air, a critical accessibility and inclusion issue released late last year. In the mid-1800s, English physician John Snow discovered that people could get sick from drinking dirty water. When people's water source was contaminated with sewage, the rates of cholera were much higher than among people getting water from cleaner parts of the River Thames. It took time for people to believe it. This was mind-blowing stuff at the time, which seemed too hard to fix. But by preventing access to polluted water, fewer people got sick. This could be seen as the beginning of modern public health, and it was adopted around the world. Clean water prevents waterborne disease, and we benefit from it today. So why do we expect people to work, shop and live and learn in polluted air? When we could make the air cleaner, make everyone healthier and keep a lot of people out of hospital. We're realising that air quality is a health equity issue. 1 in 2 people in Australia have at least one chronic health condition, and some are more vulnerable to the health effects of the air they breathe. and that is a lot of Australians. Whether they have asthma, cancer or heart disease, and whether that pollutant is viruses, smoke, mould or fragrances. They are likely to experience more health issues in spaces with polluted air. Yet this is also something that affects all of us. Anyone can become sick and even chronically unwell from polluted air, and the Australian Government is committed to improving indoor air quality. In 2023, the Australian Health Protection Committee tasked the Environmental Health Standing Committee to prioritise work on indoor air quality. The interim Australian Centre for Disease Control is coordinating this work on benefit of nHealth, and I'm pleased to inform you that the Parliament has just passed the legislation so that we have our CDC commencing on the 1st of January next year. That's why we've been having votes and divisions in the House this morning. That is excellent news for our country. So the interim it's also called the ACDC, which our Prime Minister thought was very fittingly Australian. So some of the first products they've been developing are the Department's Indoor Air Quality webpage and summer and winter communications materials, and these are the starting points. They give an overview of indoor air quality, its health effects and simple ways to improve it. Our government has invested more than $250 million into the Australian Centre for Disease Control to improve how we prepare for and respond to public health challenges, including pandemics. I am delighted that environmental health policy, including air quality, will be a key part of its activities. And the Australian CDC won't work alone. Success will come from collaboration with state and territory governments, local government, key scientific and research organisations, the not-for-profit and private sectors and international counterparts. And there are glimmers of change already. Some high-end commercial buildings are investing in better indoor air quality for their occupants, and some public buildings and high-level events are adopting safe air practices and technologies, and I note the fact that you've done that here today. Our future steps will be guided by important groundwork already laid. The Safer Air Project's report was launched a year ago here in Parliament House. And last month, Thrive, the Australian Research Council's Training Centre for Advanced Building Systems Against Airborne Infection Transmission, published the State of Indoor Air in Australia 2025 report. The work of the Parliamentary Friends of Clean Air Quality will be crucial moving forward. And today, I'm pleased to officially launch This is not it, no. Do I have a copy? I do have the opportunity, I think it's happening through media release, so officially launched the Australian Academy of Sciences report on the science of indoor air quality. So this report's been developed with lead expert, distinguished Professor Lydia Morawski, provides an overview of current scientific evidence on indoor air pollution and its impacts. Thank you. It also sets out potential policy pathways to improve indoor air quality in Australia. I do want to thank the Academy very much for all the work that's been involved with the development of this report, and I am really pleased that we will be launching it today. It just makes sense for us all to work together to prevent people from getting sick. Just like we learnt about the value of clean water, learning about the importance of clean air is something I think will revolutionise the way we tackle health inequity this century. It's better for people, their families, employers, businesses and schools. It's better for our health system, it's better for taxpayers, it's better for our economy. So I commit to doing what I can as Assistant Minister for Health and Aged Care to raise awareness of the health impacts of indoor air quality and working with you to create safer, healthier spaces for everyone. And I commend you for all of your work and congratulate you for joining in today's event. And I look forward to continuing that work with you throughout this term of government. Thank you so much for having me.
Thank you.